Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, joined by a very special guest today, Dr. Somi. Please introduce yourself.
Hi, I'm Dr. Somi Javaid. I'm a board certified OBGYN. I've been practicing about 20 years, and I am the founder of a company called HerMD.
I love the branding so much. Your LinkedIn page is excellent. I think you've done very well on the marketing end of things. And that's one of the reasons why I wanted to bring you on is because we want people from medical backgrounds to get comfortable with founding organizations that can make a big impact in their community. I wanted to ask, way back at the beginning of your career, how did you get interested in medicine? And then how did you and why did you choose to be an OBGYN?
Well, I was always good at science and math as a child, went into pre med because of that, but went into women's healthcare because I nearly lost my mother when she was only 45 years old. So I was pre med at Northwestern at the time and got a phone call from my father saying, Somi, you need to come home. My 45-year-old young, non smoking, thin mother had left arm pain, shortness of breath, and chest pain. You Google that now and you're like, it's heart disease, right? But her doctors kept telling her it's too much caffeine, it's your kids, and they kept blowing her off. She ended up getting rushed into emergent quadruple bypass surgery and nearly lost her life. And it was at that moment that I decided to go into women's healthcare. Well, flash forward, get through medical school and residency, get my first job. I'm seeing 50 patients a day.
Mm.
I don't have time to eat, let alone go to the bathroom or to be an advocate to make change. And so, after listening to women for nearly a decade, I was like, I'm going to open a center where women are partners in their care. I wrote down 3 words on a piece of paper: empower, educate, advocate. I was going to give them longer appointment times. It was going to be insurance based, and we were going to specialize in gynecology, menopause, and sexual health care. So I opened my first center in Cincinnati, Ohio, and a few years later, witnessed women coming from 35 states and 3 countries.
Wow.
So I knew I was on to something.
I have a question about that, the longer appointment times. So I'm sure you've probably dealt with the coding and how a lot of these insurance companies, they don't like that. We've done something similar with a Delaware Valley ACO, right? Where we had these great customized appointment times, and then they said, we're not going to really deal with any of this. So not the Delaware Valley ACO, but the insurance company said, we're not going to deal with any of this. How have you gotten the insurance companies to cooperate with these appointment times?
I never said I got them to cooperate with me. It's still one of our biggest barriers to growth,
Okay.
are getting rates that we deserve, particularly given our outcomes. We do research and have outstanding outcomes. We sometimes have a hard time getting on plans going into new states. They're saying we have enough gynecologists. I'm like, well, less than 20% are trained in menopause and sexual health care. So a lot of companies have gotten around the financial piece by either going membership or concierge. That was the antithesis of the mission of the company, right? We wanted to be inclusive. We wanted to be approachable. We wanted to be accessible. So I opened a full-blown medical spa in each of our locations, which allowed enough cash to come in, surgical center, imaging, so multiple revenue streams that really supported the 40 to 60-minute appointments and allowed for superior outcomes. And very few women had to cross over to the spa. And by the spa, I don't mean we weren't doing massages or IV hydration. I mean, laser hair removal for women who have hormonal imbalances, body shaping, Botox, lasers. I mean, very mainstream, evidence based, FDA cleared treatment optionalities. And I also made sure that the medical providers were different than the aesthetic providers.
Hmm.
So your gynecologist wasn't going to do your pap smear, then walk you across the room and inject your face. I just didn't like that feeling. And so the model has worked inherently well. Women want to look and feel better, and they love the convenience of having all these services under one roof. And it helped me not go concierge, cash based, or have to pay a membership for our patients.
Why are women traveling from different states to use your services? That's one of the questions that I have.
Well, I think up now we're seeing more and more companies popping up, right? Menopause, everyone's talking about it. But back when we started in 2015, if you think about it, we were actually called a blue ocean opportunity when we went to fundraise because no one was offering true menopause and sexual health care in an insurance-based system. And so it was almost unheard of. And so that's why they were traveling to us because they were desperate for care.
And so I one of the things I wonder though is that why did you want to target this group of people and go the insurance based route? I mean, I know you wanted to be an advocate, but a lot of doctors do choose to do that concierge route. So why not offer services at a premium or at a subscription base? What was it in your life that you experienced that made you want to serve this population?
I love to teach. I teach providers. I'm on stages all the time. I love to teach patients and the general population, but I learn every single day. And sitting in those rooms day after day, listening to patients, experiencing their stories, wiping their tears, holding their hands. I'm a problem solver. Like that was the thing. I wanted to help. And to say that I'll go concierge, oh my God, it would have been so much easier. But a concierge physician on average can have a panel of patients about 150. Okay.
Mhm.
HerMD locations can handle about 10,000. And so if you are truly trying to change healthcare beyond the room that you're in, you have to make it accessible. And so I have lots of colleagues and friends that have gone concierge because insurance companies do not pay enough to cover the cost of healthcare for the provider or the patient. But it just wasn't for me because after listening to a decade of stories and then going through my own personal journey with my mother, I was not going to be yet another barrier to healthcare by putting up a fiscal or a financial barrier.
Okay, that makes a lot of sense. I have a couple questions as well on this note. One of the questions a lot of our colleagues in the health systems have is how are you handling specialty care in a way that has good continuity? We kind of worry about these, CVS, City Block, Oak Street, and then, of course, HerMD. Some of these patients probably do have some serious health concerns. What are you guys doing to facilitate that specialty kind of link?
So, when you talk about menopause and sexual health care and advanced gynecology, which oftentimes requires surgery or biopsy or imaging, you have to make sure that not only patients are educated and know their options, but you have to train providers because less than 20%, I think I saw a statistic that it went from now 20% to 31% of providers are trained in menopause and sexual health care. I developed something called HerMD University, which is all evidence based, referenced, doubly peer reviewed, and published for HerMD providers. It's our internal training program. But what we've done with that, so not only has that taught a standard of care and given care algorithms to our providers, but then we've been pulling data on our outcomes to see, hey, is our way truly better? Seeing the patients at this cadence, using these medications, starting this way, doing these procedures. And we have been pulling data across multiple chief complaints. Vasomotor symptoms or hot flashes, vaginismus, incontinence, genitourinary syndrome of menopause. And we are finding we are smashing the status quo. And so, how have we proven this? We have operationalized the education and the treatment algorithms of care. And so, we're training not only the patients, but also the providers.
What does that patient training look like? And the reason I ask this, I was at a conference about a year and a half ago, and I was working on getting our patients at the time at my job, getting our patients to their OBGYN appointments. Really wanted to get them just to get their pap smears. That's all that we were really trying to do. And at the conference, we had a students panel, and they talked about how in sex ed class, they don't talk about women's health at all.
Mhm.
So these women come out of school at 18, 19, they hit 21 and they have to get this pap smear and they have no idea what it is. And I talked to my wife about this as well, and it's terrifying, right? And once we implemented those educational tools at Jefferson, we saw a big increase in patients that were able to get this because they knew what it was. How are you educating the community? What are the techniques that you're using to get those patients to come to your clinic and feel safe?
So I'll tell you it's multimodal approach. I take a lot of stages, speak at a lot of events. We hold a lot of HerMD events ourselves because education is one of the core pillars, education, advocacy, and empowerment. And I don't believe that women can make true choices or be partners in their care without that education that's been so lacking. Social media, you will always find us on Instagram or Facebook, either teaching, live streaming events, community events. We send out a newsletter, which is very educational and has a high click through rate. And then if you look at our website, it's been done very well. This year, the final part of the HerMD initiative is to take those provider facing algorithms that are really written with a medical vocabulary in
Mhm.
mind and break those down into patient educational handouts, whether it's going to be digitized, but also in the offices. And so it's really a multimodal approach. But if you think about it, adult learners, we have to see things multiple times, especially if you've seen it before, and we all learn differently. And then we do have a podcast that I think we'll be relaunching. We've kind of been, as we're building out clinics and expanding, that's gone by the wayside. And people are like, Dr. Javaid, you need to get back on the podcast. So, multiple ways that we are educating our patients and the general public, like whoever wants to tune in to us.
Of course, that's how I discovered, you guys. I'm in this space a lot looking for different organizations, but the marketing was really well done. And it really does give off a kind of a premium, almost like what a concierge service does offer for marketing, but much more accessible. And I really enjoyed that. You mentioned a few times that you're building out these clinics. And one thing that's really interesting is each clinic you're saying can have 10,000 patients, but with those 45 to an hour long appointment times, that's triple to quadruple what most practices offer. How have you been able to manage the staff to get those appointment times up?
So, most of our clinics have 1 to 2 physicians and then 3 either nurse practitioners or midwives or PAs that are prolific at menopause, gynecology, and sexual health care. They just can't do the surgical piece. And so that's the way we've staffed our clinics to maximize the number of patients we can see. And then you have to remember something. We don't have OB patients. We do gynecology. OB patients are the ones that have to be seen weekly. And that's why hospital systems are wanting to partner with us because all of their providers, their schedules are full of OB appointments. That the last trimester, women have to be seen almost weekly or every other week. We don't have that cadence of follow up. So it doesn't fill our books like a traditional OBGYN who's still trying to do obstetrics and gynecology.
Right. And obstetrics, of course, you're going to have probably more urgent situations as
Mhm.
well that affect that scheduling and make who you have to have on staff a bit more complex. How is your satisfaction, though, of your staff? We know it's a big problem in health systems right now, low satisfaction among physicians, high attrition rate. What does yours look like?
Our patient reviews are 4.9 aggregate across the board. Culture is very important to us and a huge focus. The nice thing about our company is that it doesn't matter where the feedback comes from. There are growing pains for sure as you take one location to 2 to 3 to 4, and then you're dealing with multiple states. Have we had turnover? Yes. The sad fact is by 2025, 47% of the workforce that was there before COVID is not going to be there anymore because they don't have jobs that give them mission driven work, which we provide, work life balance, which we provide, and the ability to grow. At a hospital system, they might say you have to have this many years or this specific title. But if we have somebody, I mean, obviously within scope of practice, okay, no one's doing what they should be doing. You have immense growth opportunities. We may have someone who starts at front desk and becomes a national trainer. And so we tend to attract the best of the best and we tend to retain them. But if any healthcare startup says that they don't have any turnover, they would not be being honest with you.
Of course, there's always going to be some of that turnover. How does that work life balance look like? What is that? Are you guys leading the industry in that area?
I think the things that we have done some very unique things. So, number one, just inherently with longer appointment times, you're not going to be seeing 30, 40, 50 patients a day. Number one. Number two, we have hired a third party to take call for our providers. So
Mhm.
our providers take I'm not going to say zero call because they do handle the surgical calls that come in, but nearly zero call. So can you imagine going from 50 patients a day to being on call every third or fourth night to having a job where you see 15 to 17 patients a day with zero call? You know, they don't work weekends, and you can't say that at a hospital-based job. I know, I've done them. And we rotate their evenings. So, yes, we have to have evening hours because we have patients that work and they can't take time off or they have childcare issues. And so we are there for the patient. That is why everyone shows up. But we are able to rotate that evening schedule so that it's very fair and people can go to their children's games or go out to dinner or go play pickleball, whatever they want to do in the evenings. They have that ability. So I would say, I don't know if we're leading the industry, but we are definitely innovating it for sure.
Absolutely. It seems like probably leading the industry compared to health systems. I know health systems have some pretty big trouble in that area. So it sounds impressive. I think one of the other questions too that's really important is you mentioned, that blue ocean kind of situation that was going on when you first started the organization. This is a kind of a challenging question, but what would you have done if the industry was already saturated? Would you have still plowed forward or would you have done something else? And I'm asking this because of the physicians who are here now or other people who may want to start an organization in a saturated market.
So I bootstrapped the industry, or I bootstrapped my own locations for nearly 7 years. And I started expanding on my own. So I opened my second location and broke even in 6 months.
Hmm.
So I would have just kept expanding with the profits from the first location, built the second, but it would have been a very much slower paced growth, obviously, because I don't have the capital as a physician, right? I graduated with med school debt, put myself through med school. I would have continued to do it just at a much slower pace and regionally, maybe not gone as far because the further and further you go, the harder and harder it is to quality control and to visit those locations and travel, right? And to make sure they feel good about the brand and they've been adequately trained. I think it would have been geographically a lot more constrained had I just continued to bootstrap my own company.
Very good answer there. And so, do you recommend this path to other physicians, the path of founding an organization, of becoming kind of a people leader and a population leader? Would you do this over if you could do it again?
Wow. Those are some pretty heavy questions. I love what I do because of the differences that we make. I am a very driven person. Hard work has never scared me. I mean, as an OBGYN, I was working 100 hours a week. I have 3 kids. I'm married to an oncologist. But when you do start a company, you do give a part of yourself away. It's like giving birth yet to another individual, and so it's very emotional. And being an entrepreneur is the highest of highs and lowest of lows. Would I tell people to do it? Absolutely, because one of the number one things that's missing in healthcare is physician leadership, and no one understands the provider patient dynamic like we do because like I said, we are in those rooms, we are the ones making those decisions for the patient, and most of us are out there to help the patient and for provider outcomes. And so to have the voice of the patient and the data and the science and the provider represented, we need patient or provider leadership. And so, whether it's starting your own company, whether it is joining the C suite of a healthcare organization that doesn't have healthcare representation, meaning a provider, definitely need to start your own practice. I had done private practice, I had been an academic, I had done part time in a boutique like practice. For me, being my own boss was the best thing that I ever did. I have an entrepreneurial spirit that had kind of in medicine, they just want you to follow the leader. And I was always the square peg in the round hole and always the one saying, I have an idea and this can be done better. I got my best ideas when I found the problems or I experienced them myself. And I'm like, this could be better for the patient. This could be better for the provider. So when I designed HerMD, that's what I talk about. Everyone who's looking at healthcare, who's not a provider, is looking at it with a unilateral focus. They are focused on patient-centric solutions, which is great because healthcare is really messed up right now. But they forget about the provider. And without providers, we can't provide healthcare. And I think that I would encourage people to take the leap. It's a scary one. Would I do it all over again? Yes, I love what I've done. When I get women in multiple states telling me we've like literally changed their lives, or the other day I had a patient come up to me and she's like, my daughter is going to medical school and she literally said to me, I want to be Somi when I grow up. I want to cry, but I don't want to minimize the sacrifices that it takes. I feel like I'm working just as hard as when I was delivering babies. It's a big undertaking.
Really appreciate the honesty there. I know I've thrown you some tough questions, but I really do appreciate it. I hope that it inspires me hearing it. I hope it inspires others. I'll leave you with kind of an easier question just to leave off on. Where is HerMD going from here? What does the future look like?
Yeah, so the future looks like opening more locations for accessibility. And I think putting more locations in the states we're already in actually will maximize our impact for now. Round of capital infusion next year is the goal. And then to pick states where we can put down 3 or 4 locations. And that's better for marketing. It's better for branding and brand recognition. I mean, you commented on that. And it's also better for insurance rates. It's easier to negotiate when you have 3 or 4 locations opening up. And frankly, it's easier for hiring and moving staff around from location to location. If someone calls in sick or has a baby and needs time off, then you can move people around. And so that's the lesson I learned. The dreamer in me, I wanted to expand to as many states as possible. And that's what we did. But now from the learnings, it's like, okay, we're in 4 different states. Let's just go deeper into the markets we're in and then pick up telehealth around all of those locations because we find that women are still traveling from multiple states to the locations we have.
Any time that we might be coming to Philadelphia? Is that something that's in the future possibly?
It's on the roadmap. I don't know what year. It just depends on what happens with these capital markets. And honestly, femtech companies, I think the years I've raised have raised less than 2% of all the capital
Yeah.
out there. And we were oversubscribed both of our rounds. And so I think that really speaks volumes to what we're doing at HerMD.
Well, I do hope you come to the area because we desperately need help here with our GYN services. It is terrible right now, like 3 or 4 months waiting for just a simple 15-minute appointment. So it's a very challenging situation right now. And your company, I think, is absolutely incredible. Dr. Somi, I couldn't be more thankful for you coming on and talking with my audience and sharing your kind of story with us. Hopefully, we can have you on again and maybe in person when you open up the clinic in Philadelphia.
I would love that. Thank you for having me.